Ask the Doctor with Mike. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Hello, good morning, and welcome to Ask the Doctor. If you've got a question, you're listening to Ask the Doctors. Actually, Ask the Doctors this morning. Myself, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, and of course, my co-host this morning, Dr. Susan Summerton of the Lange Eye Institute. So we are live video streaming all over the world via the majority of social media. However, Instagram right now, we're not live video streaming. We're trying to get a password for Instagram. Once we get that password for Instagram for the internet, we'll be live on Instagram as well. But we're also coast to coast on a multitude of radio stations from California all the way up to Pennsylvania and everywhere in between. So I've been hosting Ask the Doctor for, almost 30 years, since April of 1993. Amazing how fast time flies. So once again, the phone lines are open. If you've got a question, give us a call at 1-877-969-8600. That's 1-877-969-8600. All right. And now we do have the password. So Instagram will be up and live any minute now. How exciting can that be? So we got a big show ahead of us. We're going to talk a lot about eye care today. But remember, no matter how simple or complicated your question is, we'll talk about routine nutritional supplementation for overall health as well. But you got two experts in the field of nutrition and eye care. So don't hesitate picking up the phones and give us a call at 1-877-969-8600. In a few minutes, we're going to talk about how important it is for routine eye care and why it's important to get a routine eye exam. But first, we're going to say hello to Dr. Susan Summerton. Good morning, Dr. Summerton. Introduce yourself to our listeners.
Good morning, listeners from the villages here, this beautiful, cool, sunny morning. And I just wanted to give a quick shout out to some of our loyal listeners that came into the Lange Eye Institute this week. John, Robert, and Randy. Randy even has his poodle that he does his travel show with. Just wanted to say thank you for listening and thanking to come visit us at the Lange Eye Care. And also just a quick shout out to my daughter, Mackenzie. Happy birthday to her. And we look forward to a great show and welcome all the callers.
Fantastic. And Dr. Summerton's not only a board-certified optometric physician, she is also a certified nutritional specialist, a diplomat in the American Clinical Board of Nutrition, and a fellow in the Ocular Wellness and Nutrition Society. And I'll toot her own horn for her. She is the only one in the state of Florida with all of those credentials, and one of the only one in the entire country. So she can be seen at the Lange Eye Institute in the Villages, Florida. All right, we're getting ready to take the next call. The first call, actually. Let's go and see who it is. I bet you everybody knows it is Bob. Bob, good morning. Welcome to the program.
Good morning, doctors. Pleasant Saturday morning to you both. Doctors, I have, there's a young lady in my church who is under doctor's care. She's waiting results from some thyroid investigation. And my question is simply, if this goes south on her and she has to have her thyroid removed or something major done to it, what is the nutritional response to an absence of a thyroid gland?
Okay, so that's a great question. I mean, obviously that'd probably be hypothyroid versus hyperthyroid. And just to talk about that briefly, people that are hypothyroid, and that can be a disease where the thyroid is underacting, or when they remove it, they're going to need to be on THR therapy, probably thyroid hormone replacement therapy. This is a time if they remove that thyroid, they may need to be on some drugs. Okay, they're going to need to see somebody that's in tune with thyroid diseases. But let's say that they simply have hypothyroid or something called Hashimoto's, okay? Then a diet like we talk about on this program, Bob, like the Lange survival diet, a sugar-free diet, believe it or not, there's certain supplements that can help people that are hypothyroid, B complex, selenium, believe it or not, probiotics. There's evidence that people that are hypothyroid have a very poor digestive system. The probiotic system isn't good enough. So adding additional probiotics and fermented foods to their diet. Also, there's evidence that celiacs, there's a combination of celiacs, and there's a synergy, or there's a connection between celiac and hypothyroid. So gluten-free diet is something that I would recommend. And the Lange survival diet is a gluten-free diet. And these are people that actually need iodine, okay? And once again, their doctor needs to let them know how much iodine. But if you're being treated for Hashimoto's, all right, with a treatment medical plan, you probably don't want to take iodine because it can interfere with the treatment. So, that's for the hypothyroid. Now, hyperthyroid is just the opposite. If you have an overactive thyroid gland, these people need to have a diet that is very low in iodine. So no iodized salt, limited seafood, dairy, even poultry and beef, and low amounts of grain and soy and egg yolks, things that, a lot of people are eating, with hyperthyroid. And then selenium is still good, believe it or not, for hyper or hypo. B complex is good for hyper and hypo, but L-carnitine is something people can add that are hyper, omega-3 as well. And Dr. Summerton and I see the side effects of hyperthyroid even more than hypothyroid, because that's Graves' disease. That's the most common form of hyperthyroid. And you develop something called Graves' ophthalmopathy. That's where the eyes start to bulge. And then they get something called exposure keratopathy. Their eyes dry out significantly. So, yes, there's a natural approach for both of those. We went over it pretty quickly, but somebody can Google this, and they can certainly always email me or contact us at the Lange Eye Institute as well.
I also
Okay.
wanted to
Well,
add that with, sorry, go ahead, Bob.
no, go ahead, Doc. I'm sorry.
I wanted to add that one of the most common things we see in eye care with thyroid issues is dry eye. I remember them teaching us back in school, if we have, especially women, and we don't really know a cause of dry eye and they haven't been tested for thyroid issues, that's one of the things we should look at right away. So dry eye is very common. And so supportively, we've talked about our omega-3s that come from seafood, and then seafood also, and seaweed also have the iodine in it. So that's a great thing on the fish, seafood to add to the diet.
Yep, absolutely. Beautiful.
All right. Okay, doctors, thank you so much for your input. I'll let you know how she makes out with the doctor when I find out.
Fantastic.
But apart from that, have a wonderful day and a good week, and Lord willing, we'll talk to you next week.
Thanks, Bob. Keep us posted. All right, you're
Thank you,
listening to
Bob.
Ask the Doctors. Dr. Michael Lange with Dr. Susan Summerton, both of the Lange Eye Institute and Fortify Vitamins. Give us a call at 1-877-969-8600. All right, I see some people chiming in on Facebook saying that Instagram feed isn't working. I see that, so we'll try to fix it maybe at the break. But you'll get over it. You don't have to be live on Instagram. All right, we got a few more people on hold. We're getting ready to take that call. But first, I just want to mention a routine eye exam. Everybody should have a routine eye exam. I recommend, believe it or not, age 2 or 3. Get in to see your eye care provider. We see 2 and 3-year-olds at the Lange Eye Institute. Have the eyes dilated. The dilation is very important. If you don't do a dilated eye exam, it's not a comprehensive eye examination. We dilate you so we can see the peripheral retina. The peripheral retina is where you can get small holes and tears in the retina that can lead to retinal detachments. Also, many systemic diseases can actually manifest and show up in the peripheral retina. So an eye exam may not only be a vision-saving way of prevention, but it can be a life-saving form of prevention because we're also detecting the first signs of strokes oftentimes, believe it or not, brain tumors, thyroid diseases, okay? So, certain types of cancers like melanoma, even sexually transmitted diseases can show up in the eye. Autoimmune diseases can show up in the eye, things like lupus and sarcoid. So the key is early detection. So once again, getting into your eye care provider, whether it's your optometrist or your ophthalmologist, either one is more than capable of diagnosing and treating most of these diseases. If you're going to have major surgery, you're going to have to see a fellowship trained ophthalmologist. But for disease treatment and management, you can see an optometric physician or an optometrist. They're trained and they can prescribe any of these drugs as well. So either one of those. The gist of this story is get in for a comprehensive eye exam. And with that, we're going to go to Jay in Sarasota. Jay, thanks for holding. Good morning.
Hey, thank you for taking my call, doctor. I have a question about floaters. I saw an article that said eating pineapples can help remove floaters. What's your opinion about that?
Yeah, so pineapples are high in a specific enzyme called bromelain, all right? And that's a great enzyme. It helps digestion, all right? You don't want to overdo it, though, because if you eat too much pineapple and too much bromelain, you can get tachycardia. So that's a very rapid heartbeat, which we don't want, especially if you have a heart arrhythmia already. So everything in moderation. I am not so familiar with that study, but I'm going to let Dr. Summerton chime in on that.
Yeah, I agree. The bromelain from the pineapple. I've had quite a few patients bring that up, and we do know their gut health is related to all the systemic health, including the eye. So fixing the digestion, we're going to have benefits of just overall lowering inflammation, which we know is kind of the root cause of about 99% of disease. I've had some luck. Patients probably have heard of hyaluronic acid. That's kind of popular these days in the face creams. I even have it in my own toothpaste. It's a moisture binder. We use it in our artificial tears. Our favorite artificial tears contain that hyaluronic acid. So I've had some good luck with patients using that. It's in kind of the hair, skin, and nails section because it's popular for that. And they've noticed a reduction in floaters. But with any kind of floaters, we want to make sure what kind of floaters they are and make sure they're not causing an issue from the retina tear or detachment. So that's another reason to get a comprehensive eye exam with your eyes dilated so we can figure out the cause of them.
And, also, there's some evidence that some other nutrients can actually help with floaters. I mean, things like pine bark extract, grapeseed extract, bilberry, and even some specific amino acids. But then again, you got to look at this because people develop floaters and time, Jay, just time can oftentimes help those floaters go away. They slowly go down out of your line of sight and they become less noticeable. So let's say we're going to study, let's just say hypothetically, I come up with a theory that 500 milligrams of vitamin C is going to help floaters, right? And so I take 20 patients that have had a sudden onset of floaters. I put them on 500 milligrams of vitamin C, and I see them back in 4 to 6 weeks. Well, majority of those floaters are gone. Well, was it the vitamin C or was it just time?
Yeah. The problem I have is my right eye was injured by a handball, and I had to go for surgery at Cleveland Clinic, and Dr. Kaiser operated on my eye and tried to straighten out my retina, but it wasn't real successful. I'm 20/80 to 20/100 in that eye. And so I only having the left eye, I'm worried about it. I saw a doctor about having the floaters removed by changing my fluid, but he said there's a small chance of it not working. So I'm kind of worried about it, hoping just eating pineapple would go. But you mentioned it's heart arrhythmia. I have AFib problems, and so that might be bad for that too.
Well, everything in moderation. I think a little pineapple is fine. And pineapple, you put it in your protein shake in the morning. The bromelain helps really break down. It actually has protease in it also. It helps break down the protein and absorb the amino acids. Just don't eat the whole pineapple, okay? And Jay, I would take the stance, if it ain't broke, don't fix it. Since you only have one good eye, you have to be very apprehensive about having any surgical procedures in that eye as well. So if it's just a few floaters and they're not bothering, as long as you're not getting flashing lights and thousands of floaters like Dr. Summerton mentioned, that could be a sign or a symptom of a retinal tear or retinal detachment, then I wouldn't do anything right now. Eat a good diet consistent with the foods I mentioned on the Lange survival diet, or something like the paleo diet, a Mediterranean diet. Get a good amount of exercise, get down to your ideal body weight, try to get a good night's sleep, and hydrate with plenty of good fluids. And then hopefully your vision will stay stable and you'll live till you're 108.
Well, that'd be great. Yep. I really appreciate you taking my call.
Okay. Thank you.
Okay. Thank you.
All right. We're getting ready to go to the next call in just a second. 1-877-969-8600. That's 1-877-969-8600. If you want to go to the Fortify Vitamin Company and see the supplements that we've developed and learn a little bit about the science on each supplement, and you can even order them, you can go to fortify.com. That's FORTIFEYE, fortify.com. And go to the bundle section, because we've taken different supplements that work synergistically together and bundled them together with a dramatic discount, and you also get free shipping. So look at the bundles and take advantage of those savings. All of these supplements we've studied extensively. They're evidence-based supplements. I put them in my body, my 96-year-old mom, my 16-year-old daughter, and all of my patients. So if I'm going to take and give it to my family, it's going to be the best product possible on the market. Before we go to the next call, Dr. Summerton, I just want to go back a little bit talking about floaters, because it is really important. We see this a lot of times, and you noticed, I mean, just the other day, you picked up an asymptomatic retinal tear, and then you found another retinal tear when the patient just had a few little floaters and didn't have all the other symptoms with the flashing lights and thousands of floaters. So that is why it's so important to have our eyes dilated, isn't it?
Absolutely, because those we cannot see without the eyes dilating. So even during a regular comprehensive eye exam, when you're coming in, we're not just checking to make sure you get 20/20 vision. We're checking for any of those eye diseases, looking not just in what we call the central retina, but that peripheral retina that's really difficult to see. But that's why the pupils enlarging and dilating your eyes, nobody really likes doing that. But we need that to open that window so we can see the entire retina and find those things that maybe we weren't even expecting to find. And hopefully we can prevent any further loss of vision. And the sooner we catch it, the better it is.
Absolutely. So get in to see your local optometrist, ophthalmologist, have your eyes dilated. Don't just do the little test. They say, oh, you don't need to be dilated. Do this test. It's not the same thing. All right, we're going back to the phones. Another caller in Sarasota. I think it's Lou. Lou, good morning. Thanks for holding.
Good morning, doctors. Question on a sty. I've had styes before, but it's on the bottom lid, but it's on the inside. It looks like a canker sore on the inside of the lid. Is that possible that the sty is inside? I thought it was just on the lids.
Let me ask you this. Is it painful? Is it tender to the touch?
It was, but I've been putting hot compresses on to, relieve it.
Right. So that sounds like an internal hordeolum. And obviously, without seeing it, we can't tell you definitively. But an internal hordeolum is kind of the medical term for a sty. And the best way to treat these is hot compresses 2, 3, 4 times a day for 10 minutes, and then massage that little bump while the hot compresses are on there. You can buy a mask. Everybody makes a specific mask, the Bruder mask, the Optase mask, the Oasis mask. This is a mask you can put in the microwave for 20, 25 seconds, and then it just Velcros on the face. And, you sit there and it holds the heat a little bit longer than a washcloth. So that's good. But also, we want to get to the underlying etiology of these styes. People that develop styes quite frequently oftentimes have a condition called blepharitis. And blepharitis is when you get this kind of flaky buildup on your eyelashes, and it can be staph bacteria. It can even be Demodex mites and mite eggs, believe it or not. And so keeping the eyelashes clean with something like an OcuSoft lid scrub or an Optase lid scrub pad or foam, or something called hypochlor solution. Optase makes one called Protect. Oasis makes a hypochlor solution. Everybody makes a solution. And even if you have a really bad crusty eyelids, it could be Demodex. So you go straight to something called Demodex Oost. That's made by Ocusoft, and that'll kill the other stuff too. So that's kind of the ultimate at killing off blepharitis. Ocusoft Demodex Oost. So some of these things you can buy over the counter at Walgreens. You can get all of them on our website at fortify.com. You can often get them through your doctor's office. So lid hygiene is crucial. And then another trick of the trade, Lou, is a supplement I always talk about. I always tell people if you only took one supplement, only one supplement, it should be omega-3. And it should be a reesterified triglyceride form omega-3, not the ones over the counter that are ethyl ester molecules. Those have ethanol attached to their backbone. So something like our Fortify Super Omega, there's a few other good brands you can get. But the omega-3 studies indicate just as shortly after taking the omega-3 gets into the meibomian fluid in your meibomian glands. And what it does, it helps lower inflammation in these meibomian glands, but it also helps lower inflammation and improve circulation in the entire body. So hot compresses, lid scrubs, lid hygiene, omega-3, and plenty of fluids. And that should help. And obviously, if it gets bigger, you're going to have to go to your local eye doctor. They may have to drain it. They may have to put you on oral antibiotics sometimes. We have to use that. And I'm going to let Dr. Summerton chime in because she's kind of an expert. She's been seeing all of the styes at the Lange Eye Institute lately.
Okay.
That's true. We seem to be having a run on styes lately. And again, that's something we're looking for on every eye exam when we're looking under that microscope with a bright light. We're looking at people's lids. If we see that blepharitis, we want to take care of it. When anything ends in itis, that means it's inflammation. So you have inflammation of those eyelids. If it's inflamed, then you're more prone to getting those bacteria that can go into either that little hair follicle in your eyelid or those glands, and that's either going to produce a sty on the inside of your eye or a sty on the outside. The sty on the outside are kind of easier to tell because you can look in the mirror, you can see that little red bump. The ones on the inside, it's hard to see. You maybe see some swelling, but you certainly can feel some like tenderness and soreness there that we know there's that infection of that bacteria that gets in there. So we want to, as soon as the first sign of it, we want to put those warm compresses on, but not just a little washcloth. We want on there for a good 10 minutes, several times a day. I know personally, just a little while ago, I started feeling one in the corner of my eye. I have one of those masks you actually plug in. It also helps dry eye, and I put that on it. I did it like 3 times, and I was able to stop it from coming. So, and it could just be not just the blepharitis. Maybe you touch something that had a little bit of bacteria on, you happen to rub your eye, you go to the grocery store, touch those grocery carts, and touch your eye. We just never know where it came from, but we certainly know that the bacteria can cause it, and we take care of that with the warm compresses, like you said, and maybe some antibiotic, either in the form of ointment or an oral antibiotic too. We don't want it to spread. Sometimes they get in the lids, and they can become pretty severe if they can turn into what we call a preseptal cellulitis or even a cellulitis. So we don't want that infection to spread. So again, the sooner we catch it, the earlier we treat it, the much better off we are.
Amen.
Yeah, doctor, you mentioned a moment ago, both of you, the business of the dry eyes coming from a thyroid situation. I have been taking Synthroid for probably 25 years now for a thyroid situation. So that could cause the dry eyes that I have?
Absolutely. All thyroid patients are more prone to having dry eye. How old are you, Lou?
I'm going to be 80 to June.
And I hate to say this, but like everything else, aging also has something to do with dry eye. The older we get, the drier we get. And that's kind of a normal process of maturing, but we can age gracefully by doing the things that we talk about on this show. I developed a few years back now something called advanced dry eye therapy, and I'm holding it up for all of our video, viewers out there right now. As a matter of fact, we're live on Instagram finally. But anyway, advanced dry eye therapy, Lou, takes a combination of our Fortify Super Omega, our Fortify Focus that I talk a lot on this program that has lutein, zeaxanthin, mesozeaxanthin, and astaxanthin, and then something called GLA from black currant seed oil. And the reason these work synergistically together, I mean, I've got thousands of patients on this, and I studied it for years and years and years before I developed it, is because of the anti-inflammatory properties. A lot of the dry eye and things that are related to thyroid disease and all these other collagen vascular diseases, like arthritis and tendonitis and conjunctivitis and keratitis and episcleritis. I mean, these are all related to inflammation. So if we go on an anti-inflammatory type of diet, once again, similar to the Lange survival diet, and take a supplement similar to the advanced dry eye therapy, then you're ahead of the ball game. At least you're taking a proactive, natural approach. The other three, it's got three, something to try. And believe it or not, you'll notice an improvement in your joints, and pain in your body and skin texture. You'll also notice when you go over your blood chemistries, certain things like lipids, cholesterol, triglycerides can also improve when you're taking supplements similar to this.
Okay. I appreciate that info because all I've been using right now is Sustain Complete, and that's helped me out.
Right. I mean, that's just a lubricant. And remember, we always talk about the 4 phases for dry eye, the natural approach. We heat the lids, we clean the lids. We talked about that just now. We nutrify the glands. That's where the Fortify Advanced Dry Eye Therapy comes in. And then we lubricate the eyes with a good lubricant. If you buy them over the counter, get the preservative-free form, okay? Not with preservatives in it. 2 that I like the best are Oasis Tears and Optase. You can buy Optase over the counter. You can't buy Oasis Tears over the counter. They both have hyaluronic acid in it that is a natural anti-inflammatory. Remember, we talk a lot about inflammation in the eye. So Oasis Tears or Optase, think about those.
Okay. Thank you very much, Doctor. I appreciate it.
All right, Lou. Have a good day.
Okay.
And if you would like to see any of the good doctors, Dr. Lori Caputi, of course, Dr. Susan Summerton, or myself, Dr. Michael Lange, at the Lange Eye Institute in the Villages, Florida. It's just a hop, skip, and a jump from any place in Florida. It's a little bit of a hike from California, however. You can call. I'll give you the number for the Lange Eye Institute. It's 352-753-4014. That's 352-753-4014. Now, remember, we also have a nutrition center in Ocala, the Lange Nutrition Center in Ocala. And as a matter of fact, Mandy, who used to run Fortify Vitamins, is there now. And Doc Hall, believe it or not, has a new job title. So Doc Hall, now starting Monday, will be in the Lange Eye Institute. The Lange Eye Institute will have our PhD Doc Hall, nutritional guru, in the Lange Eye Institute, helping people to be able to pick out what supplements and vitamins and talk to them about nutrition free. It is free. So come on by the Lange Eye Institute, see Doc Hall. He should be there 8 o'clock Monday morning. He'll be with me the whole week with Dr. Summerton. So, 3 certified nutritional specialists all under one roof. And Doc Hall also has a PhD in clinical nutrition. So remember, Doc Hall will no longer be at the Lange Nutrition Center, but Mandy will be. Doc Hall will be at the Lange Eye Institute, helping, lots of people. All right, we're getting ready to go back to the phones. If you got a question, give us a call, 1-877-969-8600. That's toll-free, free consultation, never replaces a medical evaluation or an eye examination. This is for educational purposes only. Give Dr. Summerton and myself a call at 1-877-969-8600. All right, let's go to Steve in Clearwater. Steve, good morning.
Yeah, I just wanted to give some advice to Bob. If he's doing research on the thyroid, there's a couple things that he should be aware of. Number one, in the literature, don't confuse iodine, which is diatomic iodine, with iodide. Your body can use both of them. But one thing that'll happen is if you get an iodine stain, iodine is purple, and you get an iodine stain on your nice new white pants, okay? Bleach won't get it out, soap won't get it out, anything. But if you take a vitamin C tablet and rub on that iodine, it will completely disappear. And that's because the vitamin C changes the iodide, which is purple, to iodine. From iodine to iodide, which is colorless. In fact, you'll sometimes see in the drugstore colorless iodide, and that means that it's iodide instead of iodine. And also, he should be look out for the difference between armor thyroid and T3 and T4. That's very important to think about. And also, there's certain areas of the country, like near the Great Lakes, around Ohio, northern Indiana, eastern Wisconsin, where people don't get much iodine in their diet at all. And if anyone's listening from that area, they're much more likely to have an iodine shortage than.
Wow.
And
Steve,
and one more thing.
Right.
If we pretty much cured goiters by iodizing salt.
Right.
But then everybody realized that salt was a bad thing and lower your sodium. Don't salt-free this, salt-free that. And goiters started creeping back after that. So that's something to think of too.
So I got a question. Last weekend, Tammy and Mackenzie were up in Chicago playing volleyball. And so I was bacheloring it. And I went ahead and washed my scrubs. And I didn't realize it, but I had a Fortify Focus and Brain in my scrub pocket, okay? And remember, this has lutein, zeaxanthin, and astaxanthin, and cognizine, and that's a very red color, all right? And it stains too, I guess kind of like iodine. And so I put it in the wash with my scrubs, and those are light blue, and a few white shirts and a few other things, and did the wash. And this stuff was all over my clothes. And then I put it in the dryer, and now it looks like I got these fluorescent scrubs. So maybe I should put some vitamin C in the washing machine and wash it with vitamin C. What do you think?
I don't think that would work for that. You say that you think it was the carotenoids that stained everything?
I know it was, yeah.
And it won't. In fact, it'll make it worse.
All right.
I would think.
It's worth a try though, because they look kind of funky as it is.
But what you might do is just try a solvent, like, soak them overnight in like Dawn or something. Or another thing you could do, here's a good idea. Don't get a chlorine bleach, or you'll completely wreck what color are the scrubs?
Blue.
Okay. Get some OxyClean.
Okay.
Oxy.
I've heard
of that. And that's an oxygen bleach, and that will not disturb your oxygen stable dyes in your scrubs, but it will, I think, be strong enough to oxidize the carotenoids. But I'm not sure. But
I think, Steve, the gist of this story is just keep me out of the laundry room.
Well, there you go. That might be good. But that might be a good advertising.
Don't put the supplements in your pocket. Put them in your mouth.
Yeah, I know. Yeah, I forgot they were in the pocket because, you see, I hadn't taken the Focus and Brain yet. If I would have taken the Focus and Brain, I wouldn't have put it in the pocket, and that way I would remember. So I've been on them for about a week now, so I'm not going to have any forgetful times anymore.
Well, now you know what your brain looks like.
All right. Okay. Thanks, Steve.
Okay, bye.
All right, you're listening to Ask the Doctors. I'm Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins with Dr. Susan Summerton, also the Lange Eye Institute. And she's also hangs out with Fortify Vitamins as well, and is a guest lecturer around the country. We're getting warmed up. She's getting ready to lecture all on eye disease, natural approaches to eye disease. You've been working pretty diligently on this lecture, haven't you?
Yes, I have. And we're, talking about the common things that we talk about this show, but I'll actually be teaching other doctors, the common nutrients that we use just in general eye exams for helping our patients. Omega-3 definitely comes up. I've been researching a lot about curcumin. That's that yellow pigment of that turmeric. We have that supplement in the next gen curcumin that we use a lot in our office, just for all the amazing properties that it has. It's just anti-inflammatory, antioxidant. It stops that oxidizing that can cause disease. even anti-diabetic properties to that. We just use it for so many things. And it's also synergistic. So we never really harp on just one thing, because there's always a multitude of things that we can use that if we add one to the other, it makes it work better. Like we add that black currant seed oil to our omega-3 for the dry eye, because that works a little better when you have it together for some people. I'm researching all that lutein and the zeaxanthin, that's those carotenoids that come from those green leafy vegetables and the orange vegetables, and how much benefit they can have in our eye. You know, what's interesting is right now we only know lutein and zeaxanthin is only found in the center of our eye, the macula. So out of all our research that we have on these nutrients, and people have researched them for years and years and years, that's the only place that we found that they're stored. So we have tons of information on how much they can benefit our eye health and prevent diseases, help treat diseases, all those diseases that we look for in an eye exam. We can recommend different nutrients and different supplements, and I'm trying to help other doctors be able to incorporate that into their practice so we can do a more integrative approach. So we do use medicines, but we can also use natural remedies too. Pine bark extract that we talk about a lot. You mentioned that before, but it's something we use in glaucoma issues. Another disease that people might come in and not realize they have, because you can see 20/20 and you might end up having glaucoma. So we're constantly looking for things that can help naturally. And I love researching, I love learning, and then I love sharing it with our patients and other doctors.
Absolutely. And you are fantastic at doing it. Our patients love you and our doctors love you. Our radio listeners love you. So we're blessed to have Dr. Susan Summerton now on the Lange Eye Institute and Fortify Vitamin team. So thank you for all that. And she brought up a valid point before we take the next call. The curcumin, the next gen curcumin, you used to hear us talk about this a lot. We worked on this for years and we have it finally out. It's called next gen curcumin, and it's in a capsule and in a gummy. It works synergistically with everything. It works synergistically with the omega-3. It's great at helping reducing beta amyloid plaque in the brain, believe it or not, for patients that have, forms of dementia. Studies indicate that it can help support that. It helps with drusen in the macula. Some studies out there showing that it can help with dissolving these drusen, or helping these PEDs from drusen go down. So now we're recommending the curcumin in conjunction with the macular defense or the advanced retina formula, and of course the omega-3. So there's supplements that I recommend to just about anybody and everybody at any age, and that's the omega-3, the Fortify Focus, and the curcumin. And the curcumin more so after the age of 50. I think when you're very young, maybe the curcumin isn't as important, but after the age of 50, it has some amazing health benefits. And you can learn about those at the website at fortify.com, FORTIFEYE, fortify.com. Look at Next Gen Curcumin, and then again, look at all the bundles in there. I'm going to give you the toll-free number for Fortify Vitamins. I'll give it to you twice. That's 866-503-9746. That's 866-503-9746. All right, we're going to the phones. We're getting loaded up. Let's go to Sharon in Williston. Sharon, good morning. Thanks for holding.
Morning. Heard you talk inflammation in the eye, and I have it in one eye more than the other. It's not real bad, but in the morning I'll have some little discharge and mucus discharge. And I'm on your Super Omega Max, right, and Fortified Focus and Next Gen Curcumin.
Right.
And I wondered if you thought it could be an infection or just what?
Well, if it's just a mucousy color, it's kind of yellow or clear, is it?
It's white.
It's white. Okay. Yeah, that's oftentimes related to some dryness early in the morning, okay? And it can be related to a little blepharitis on your eyelids at bedtime. So what I would recommend, Sharon, is just cleaning your eyelashes right before you go to bed at night, all right? With one of the lid scrub preparations that you probably already have, or we have them on the fortify.com website. Clean them really good right before you go to bed, all right? And then right when you wake up in the morning, put a good lubricating eye drop in your eye, like the Optase or the Oasis. And I would venture to say that you're going to do a lot better if we get rid of the culprit of the problem prior to bedtime by just cleaning the lashes really good. So you brush your teeth and clean your eyelashes, not with toothpaste though. And and then let's see how you do. I think you're going to be better. Now, if you told me you had a thick green discharge coming out, then yes, that sounds bacterial, even brown, and you probably would need an antibiotic. And if, certainly if you're at all, if it's getting worse or you're at all concerned, come and see us or see a local eye doctor there, because, you may need an antibiotic, topical, usually not oral, but chances are if it's just, whitish, it's probably not bacterial. So try what I said and then keep us posted.
Okay, well, I've been using the Optase Plus, and I like it. I use it at night and in the morning.
Well, it sounds like you're doing exactly what you should be doing. So I would keep doing that. Just clean your eyelashes a little bit more before bed. And if it gets worse, you let us know, and we're available 24/7.
Okay, well, thank you so much.
All right, Sharon. Thanks for the call. All right, we're going to Barb. Barb is next. Barb, thanks for holding. Good morning and welcome to Ask the Doctors.
Oh, yes. Good morning, doctors. It's been a great show. So much information, valuable information. Where I'm asking about glaucoma again. My friend has had the tubes, and the pressure keeps gradually going up. What advice can you doctors give me?
Well, obviously she needs to stay in tune with her doctor, frequent visits. So anytime pressure's going up, it can damage the optic nerve. And that's what glaucoma is. Remember, it's the sneak thief of your sight, because like Dr. Summerton had mentioned, there are no symptoms until it's too late. So it sounds like the pressure was probably getting a little high, and they used some surgical intervention to lower the pressure. Now, if the pressure's starting to go back up and she is not on any topical glaucoma medications, she probably needs to try getting on a topical. Her doctor needs to prescribe some topicals. Okay. Now, there is a natural supplement that you can take that has worked amazingly well. And between Dr. Summerton and myself, we probably have more people on it than anybody in the country. And it's made by a company called Life Extensions. It's not made by Fortify, and it's called Eye Pressure Support. It has something in it called mirtogenol. It's a combination of bilberry and pine bark extract. And I didn't believe it, but I put 24 patients on it, and 23 out of the 24 patients came down dramatically. I mean, 25, 30%, and only one didn't respond. That was amazing to me. This does not replace, treatment for glaucoma. It doesn't replace the drops of the surgery, but it's a natural way of helping the body lower the pressure. It also improves night vision and reaction time. So I take it, since I race cars, I want to have improved night vision. I want to have good reaction time. I don't take it for the pressure lowering qualities, but anybody that's suspicious for glaucoma, may have glaucoma, I at least make that recommendation. Let's put it this way. It can't hurt.
Very good. Thank you so much.
And Dr. Summerton, you want to chime in a little on that?
Absolutely. We had mentioned that synergistic of doing more than one thing. That study also showed, using that mirtogenol eye pressure support vitamin, it does actually work well with one of our prescription eye drops, latanoprost. So they work better together. So it has that helpful effect. There was another study, I think, about the Sun Project, and they were researching vitamins A, C, and E, and they found that alone they didn't work. But when you use them together, they did lower that risk of glaucoma.
Right. So we have a lot of things we can do naturally to support traditional medical and surgical treatments, and also cardiovascular exercise is effective. Getting the heart rate over 100, as long as you don't have heart problems. Cardiovascular exercise can lower the pressure. Weight management can lower the pressure. High dosage of vitamin C and the vitamin E and the vitamin A, like you said in that study, and omega-3 also. So a lot of the things that work synergistically together for overall health can actually lower intraocular pressure. But I'm very impressed with Life Extensions eye pressure support. And if it's not Life Extensions, it's the mirtogenol is the supplement you would look for.
Thank you so much. And also, back to the importance of an eye exam, I'll never forget. This has been several years ago. You gave my husband an excellent eye exam, and you saved him from going into glaucoma. And we've always been so grateful for that. But you guys are great. Thank you so much for this great program.
Oh, thank you, Barb.
Thank you.
And that's what we pride ourselves on. The Lange Eye Institute in the Villages is a state-of-the-art facility. We've spared no expense. We've got the latest technology to help our doctors make the earliest and the most appropriate diagnosis, the most accurate diagnosis. And one of the reasons for a routine eye exam, if for any, is to detect glaucoma, because like Dr. Summerton mentioned in the beginning of the program, it is the sneak thief of your sight. You have no pain and you have no blurred vision. Then all of a sudden you start to lose your peripheral vision. It's like the proverbial snowball, and you can't stop it. It's difficult to stop. So the key is early detection. If we find somebody that's slightly elevated pressure or very suspicious optic nerve, they may not have glaucoma. We can take a proactive role therapy medically or nutritionally to help prevent it from turning into glaucoma. All right, let's go to the next call. Tom in Clearwater. Good morning, Tom. Thanks for holding.
Oh, thank you. I'd like to literally pick your brain for any ideas or suggestions. We have a condition that I believe goes by homonomous hemianopia, that is a problem with the brain processing the visual information.
Right.
And it was as a result of brain surgery to relieve pressure from meningioma, which is a common growth in the brain. But after post-surgery, we lost about half of the visual field on the right side because of the location on the occipital lobe.
Right.
Do you have any recommendations or referrals for therapy or something to increase brain plasticity to help the brain reorganize? I know it's not quite eye related, but it's the functioning of the receptors in the occipital lobe of the brain.
Right. That's a good question. And we see this all the time at the Lange Eye Institute, and oftentimes from trauma, from brain tumor, from surgery, from a stroke. You know, a homogeneous field defect can be right side, it can be left side. You can have bitemporal field defect related to pituitary tumors. And so, you know, if you look at any side of the bright coin, at least it's the right side instead of the left side. Some people still drive with a homogeneous field defect. And if it's the left side that it's affected, it's very bad because that's the rear view mirror on the left side, and then you can't see out of it. So there are field awareness prism glasses that can be fit, all right? We used to do these years ago. We don't anymore. The leading authority on this literally in the world is Dr. Dan Gottlieb in Georgia. He might have moved to North Carolina. I think he's back in Georgia. So you can Google that name, Dr. Dan Gottlieb. Gottlieb. He's actually a good friend of mine. I did a rotation with him at his Stone Mountain, Georgia, and that was all about neuroplasticity, all about people that have homogeneous field defects from strokes and brain tumors and surgical procedures and traumatic brain injuries and things like this. And he always takes calls, so you can get in touch with him, and he's written a lot of books on this, and he can make some amazing recommendations. And if for some reason you can't contact him, I'm going to give you my email, Tom. So write this down, and
Okay.
you try to reach out to him. If you have no dead ends, you contact me, and I'll hook you guys up. Okay. But my email is idude92. So that's EYEDUDE 92 at iCloud.com. So that's ICLOUD, iCloud.com. So try to get in touch with Dan Gottlieb. Let him know that you heard me on the radio and I recommended it. And if you have dead ends, you contact me and I'll work it out for you.
So blessed to have found you. I appreciate the help you give to everybody. And have a blessed day.
Thank you, Tom. Thank you, Tom. All right.
Tom.
We're getting ready to run out of time. I'm going to give you the phone number for Fortify Vitamins. That is 866-503-9746. That's 866-503-9746. check out the supplements we've developed, the supplements that we use in our clinics at fortify.com, FORTIFEYE.com. And, that's the music. We've got about 30 seconds left, Susan. So I'm going to let you tell everybody goodbye.
Thank you for listening. And I want to encourage everybody, go in and get your comprehensive eye exam, including that dilation. And we can hopefully find or tell you there's not any eye disease there, but keep your eyes healthy and keep your body healthy.
Thank you. And remember, the key is early detection. So take a strong preventative approach. It's a beautiful Saturday. Get out and get some exercise in the sunshine. And with that, I'm telling everybody goodbye. Happy Saturday. God bless you and God bless America.